here in the UK where we have evidence. And so what we're really seeing here is that communities of color are disproportionately affected, both in terms of exposure and death to coronavirus. And this is just exposing a deeply entrenched pattern of structural inequality and institutional racism that puts communities of color more at risk. This is true of HIV, this is true of cancer, and just about virtually every other health condition that you could name.
And why do you think that is?
So again, this is based on a long history of structural inequalities. In some cases, this is going to be housing issues. This is going to be less access to healthcare and education. Management of chronic diseases, which is often poor, will put folks more at risk for complications of coronavirus, and the list goes on.
I mean, COVID-19 is being described as the great leveler. Death, fear, stress, they're all great levelers. But from what you're describing, obviously, people are not being affected the same by this.
The virus does not discriminate, but we do. And I think that's ultimately what we're seeing here.
And it's not just suffering from COVID-19 that is that is causing this impact. It's also an unequal distribution in terms of the number of people that are suffering from depression, from stress, from anxiety, suicidal thoughts, an increase in those disproportionately in some areas.
Yeah, that's absolutely right. And again, health inequalities are deeply entrenched in the U.S. along racial lines and also along class lines, and it cuts across chronic disease categories like diabetes and heart disease. It includes mental health and includes infectious diseases ranging from HIV now to coronavirus.
And so what should the policymakers, those tasked with caring for communities, do? What can they do to tackle this right now?
Well, I think there's a short-term response and there's a long-term response. In the short term, we need to understand that there are particular communities that are going to be more vulnerable and more likely to be exposed to coronavirus. And so we need to make sure that testing is being rolled out and that care can be improved, particularly for the uninsured in those communities where we know people are most vulnerable. Over the long term, we need to have a really long, hard look at how both our healthcare system is organized, social safety net more broadly, so we can have structural.
I mean, currently, obviously, the situation is one of firefighting the situation that we're in. But in terms of the long tail on this, what would your expectation be of the long-term impact on people who are suffering greatly as a result of what's happening?
Well, I think over the long term, again, these communities that are going to be disproportionately affected are going to then further suffer. You know, the effects of disease can often plunge families further into poverty. And so if anything, the outcome of this, remember that in poor communities, it's much more difficult, for example, to be able to comply with social distancing guidelines and things like that. And so I think there's a real risk that existing inequalities are only going to be deepened or worsened by COVID-19.
Thank you very much for joining us, Dr. Peter Drobak.